أهلا وسهلا، كيفك خالد؟ مبسوط
أهلين
شفتك
طريف،
حبيبي.
كيفك؟
الله يرحم أيام زمان، والله مشتاق لك مشتاق لك.
كان صار لنا 2003 آخر مرة اجتمعنا فيها بالسامز بالشام.
الشام سبحان الله، لما زلت على الشام 2002 صح؟ أي والله صح، سبحان الله عاش. بس دنيا عم تركض. بس والله عم بقول لهم الشباب أحلى أيام حياتي لما كنت بالشام من 2002 2010 بدرس بجامعة دمشق. هدول أحلى أيام، كنت بدرس معلوماتية وطب بشري وتمريض. أروع أيام حياتي كانت. يعني ما في أحلى من ذيك الأيام يا لطيف، بتمنى أعيدها والله من أول وجديد. طلاب ما في أحلى منهم على فكرة، ما في أحلى منهم، بس مساكين ظروفهم صعبة كثير، كانت كثير صعبة. بس
طيب
الله
شو
توفق.
رأيكم هيك quickly 2 minutes كل واحد introduce himself quickly بس يعني say who he is, where he's from, what's his specialty. شو رأيكم؟
يلا بلش فيك أخي خالد.
الله يخلي لي خالد الأحدب, pediatric cardiologist, electrophysiologist here in Chicago.
طريف بكداش، عصبية أطفال بيونيفرسيتي اوف كنتاكي.
ربيع
يلا
الحوش
نسمع.
بيدياتريك جي اي. عفوا انا شفت
تفضل راب.
تفضل.
ربيع الحوش بيدياتريك جي اي University of Nevada in Las Vegas.
يحيى عبد الرحيم، بنما سيتي فلوريدا، بيدياتريك هيماتولوجي اونكولوجي، لكن بمارس الان بيدياتريك هيماتولوجي في
يحيى
بنما
بيك،
سيتي فلوريدا.
كيفك يا يحيى بيك؟ اشتقنا لك.
بخير والله الحمد لله. الله يعطيك العافيه ويجزيكم الخير كلياتكم ان شاء الله.
أهلين أستاذنا، الله
أهلين
يفتح عليك.
أستاذنا.
الله يبارك فيكم، الله يحفظكم جميعا والله. شكرا كثير والله، الله يبارك فيكم.
الله يخليك. تفضلوا.
فارس البيطار، أنا pediatric intensivist in Houston.
هيوستن.
أهلين أخي فارس.
الله يسلمك.
أنا ناصر قباني بيدياتريك جي آي بشيكاغو.
يا أهلا.
على راسي ناصر بيك.
الله يخليك، تسلم.
لحد هلا الجي اي اغلبيه، يا من سمادي، اورلاندو، بيتس جي اي، ارنو بالمر هوسبيتال. نحن مو يونيفرسيتي بس شوي اكاديمية، عندنا فيلوشيب.
ما شاء الله.
يا أهلا.
لؤي منيني، عفوا تفضل.
Go ahead.
لؤي منيني بيدياتريك جي اي بمايو روتشستر مينيسوتا.
شو هذا الجي اي ذبحتونا انتم اخي؟
دخلوا. تفضل.
يحيى حجازي pediatric cardiology وانتنسيف كير بسنسناتي.
من جماعتك.
أهلين حكيم.
هذا من
نورنا.
جماعتك خالد.
أهلا فيكم.
أهلين حكيم.
تمام.
يا ميت هلا.
أنا محمود قلاش من بيدياتريك نفرولوجي بكولومبوس أوهايو.
أهلا
وسهلا.
أهلا وسهلا.
هيثم شحرور pediatric pulmonologist Emory University Atlanta.
ما شاء الله.
سهلا.
ما شاء الله. أهلا وسهلا.
مرحبا، أنا لين الخطيب pediatric hospitalist ب University of Arkansas.
احنا مع الدكتورة
أهلين
دلع.
حكيم.
مع الدكتورة دلع.
إيه بعرف دكتورة دلع، إيه طبعا. أنا من الجيل الجديد.
يا أهلا.
يمنى مصطفات، West Virginia University Pediatric Hospitalist.
أهلا وسهلا.
فيرجينيا في على فكرة ما شاء الله جيش من السوريين. وست فيرجينيا أنا زرتها مرة واحدة.
إيه صح مزبوط، بظن التقينا.
صح.
عملت انترفيو هون صح؟
صح مزبوط صح.
صار له شي 10 سنين يمكن القصة.
12 سنة يمكن. أي سبحان الله.
صح. أنت بتعرفه لدكتور يسر أبو
أيوة.
شعر بتقلبه؟ صح تماما التقينا مزبوط.
سبحان الله، الدنيا صغيرة سبحان الله. يا أهلا وسهلا دكتورة.
ربا بربر بيدياتريك.
سوري ربا، تفضلي وأنا بعد.
شكرا. ربا بربر بيدياتريك infectious disease رويال اوك ميشيغان.
ميت السلامة يا دكتورة.
مو عندكم بلش الدكتورة ربا؟ ما هيك؟
لكن يا
ما لحقناك يا دكتورة. يلا أنا
ياسين رفيع بيدياتريك اي دي نيويورك.
أهلا وسهلا.
emergency
بيدياتريك emergency.
ما شاء الله، ممتاز.
بدنا همتك حكيمة، لك شغل كتير عنا.
إن شاء الله.
إن شاء الله. الله يسلم يديك.
بليز إذا حدا ما بيعرف عن اسمه يعمل ميوت لو سمحتوا.
ياسين رفيع Pediatric ID هارلي ميشيغان.
أهلا وسهلا
أهلا
ياسين.
وسهلا.
طارق السيد
I'm Greg
Pediatric.
Shea. I'm a pediatric pulmonologist from California.
أهلا وسهلا حكيمنا الغالي.
Welcome Dr. Shea. Welcome.
شكرا.
Welcome.
أنا محمد نجار. أنا Hospital Pediatrics in Columbus, Ohio.
أهلا وسهلا.
أهلا وسهلا.
أنا طارق السيد Pediatric Cardiologist و Cardiac Imager ببيتسبرغ، بشتغل مع الدكتور خالد كلوزلي.
ايوه دعم كثير.
نورنا يا ابو طارق.
دعم.
محمد تميم, a neonatologist, Cleveland, Ohio.
أهلا وسهلا.
أهلا وسهلا.
مع الدكتور مهند، دكتور حمصي، دكتور محمد حمصي، لك نفس الجماعة. حصني، دكتور حصني. دكتور حصني.
أظن neonatologist في حوالي عدد جيد صراحة. neonatologist بين إنديانا أوهايو.
Well, you guys are heavily needed في سوريا. heavily.
جاهزين إن شاء الله.
بخير يا جماعة. معكم بعرف عن حالي. أنا كنت ناوي أعرف عن حالي آخر شيء مشان نبلش إن شاء الله. اسمي أنا مجد جزائري. I'm a cardiologist and currently EP fellow at University of Rochester, New York. أنا adult EP fellow, but I was invited by the group to run the show here. Hopefully I will like.
He deals with the tall people.
I'll make it.
Not the short.
He's the only adult in the room.
Yeah. I do pediatric cases though. بس يعني أغلبية adults.
في مهندسين adults تانيين.
عن جد مو لازم يكون في adults بكل أرنب.
دكتور علا
علا عبد الوهاب غدد صم adults Cleveland Clinic.
أهلا وسهلا.
اسمي بيان عيسى Pediatric Cardiology. حاليا Interventional Cardiology Fellow University of California, San Diego. To add on, I'm doing ACHD cases as well. So I do adults who have congenital heart disease procedure as well. So we are invading adult world as well.
ما شاء الله.
Here we go.
أهلا وسهلا.
أهلا وسهلا حكيمي.
أنا والله عندي مؤتمر بسان دييغو إن شاء الله BAAN راح يكون بأبريل. فبركي إن شاء الله إذا قدرنا ما نتيسر واجتماعنا إن شاء الله.
Yeah.
دكتورة أنا عملت fellowship بسان دييغو Children's Hospital San Diego وخلصت 1995 years ago. Children's Hospital is like very dear to me. Children's Hospital San Diego is like one of the best children's hospital in the world, in my opinion.
Yes, it's
I
amazing.
spend a lot of time there.
Yeah, and the weather is awesome. So whoever lives in San Diego, enjoy it. To be honest, there's nothing like it. It's like heaven.
I'm
so
not too far
everyone is
from
welcome to visit.
I'm not too far from you now. I'm in Los Angeles. I'm pediatric intensivist. Muhammad Khalid.
أهلا تشرفنا فيك. شكرا.
ما تصدقوا كله حرايق وشغلات ونكتاو على فلوريدا نفس الوضع ما في حرايق.
Talking about perfect weather. نضال وحر Pediatric ICU from Michigan.
كان عندك -20 last week نضال.
خليها مستورة.
هذا البرفكت weather لميشيغان.
الله يحميك نضال حبيبنا أنت حبيبنا.
طيب يا جماعة بتحبون نبلش؟
يلا بسم الله بسم الله مجد بسم الله.
Alright, so عرفت عن حالي. نحن اليوم هذا I think this is the first meeting for SAMS Pediatric Committee and hopefully it's not going to be the last one إن شاء الله. Alright, so those are the points that we're going to go through إن شاء الله. الانترودكشن حتكون by دكتور خالد الأحداب. دكتور محمد الحصني حيحكي لنا شوي عن النيكيو experience بالنورث ويست سوريا. دكتور نضال وهر he is currently board member بالسامس حيحكي لنا شوي عن السامس structure, الفاونديشن والسوسايتي, الممبرشيب, البنفيتس اوف ذا ممبرشيب. بعدين دكتور خالد بيرد ان شاء الله بيحكي لنا عن الاديوكيشن, الكرنت فيلوشيب, الفيلوشيبس والاديوكيشن, بيحكي لنا عن الكرنت pediatric projects going on now. واخر شيء we will have ان شاء الله group discussion. هلا هذول 10 to 15 minutes each point. The group discussion will have about like 20 minutes ان شاء الله. Each question will be 2 minutes. We will answer the question حيكون ان شاء الله 1 minute just for for the sake of time. طيب هلا دكتور خالد إذا بتحب تحكي لنا شوي عن سامز اوفر فيو، شو عمل البيدياتريكس كوميونتي، شو صار بالنورث ويست، وتحكي لنا شوي عن ميشن البروجكت اللي you were running them. تفضل دكتور خالد.
شكرا مجد، الله يسلم ايديك.
I'll be sharp with you guys إن شاء الله. Okay, for the sake of time. 10
إن
minutes.
شاء الله.
تفضل دكتور خالد.
شكرا. هي الدكتورة دلع كانت بدها تحكي عن educational fellowship but she's very sick so I'm taking that for her إن شاء الله. So مثل ما قلت لكم أنا خالد الأحدب Pediatric Cardio EP. من زمان بشتغل مع سامز، نازل كذا ميشن للبنان والأردن، بس recently بعد الأرثكويك اللي صار بشمال سوريا، بتعرفوا الفترة قبل الأرثكويك كانت عصة كبيرة، كتير من الجرانت والسبلايز خفت على الشمال، فسبحان الله يعني كانت فرصة اجى الارثكويك فتحت الدنيا عليهم، فنزلنا مع الشباب وبلشنا يعني to see what's going on. دكتور محمد ما شاء الله نزل قبلي ورجع وكان الفيدباك انه they really need pediatric cardiologists. فنزلت انا بمارش not last year the year before، كانت اول ميشن الي وشفت الوضع، يعني ما كان في guesstimating in the north there is 5.5 million people، في ما شاء الله at least يعني 30-40% of the population as you know pediatrics، وكتير kids everywhere سبحان الله a lot of them are undertreated, underprivileged, undermanaged. في كذا مشفى للأطفال بالنورث نحن ما بنعرفهم كتير، أنا ما كنت بعرفهم لنزلت وشفت الوضع. ففي مشفى ابن سينا هي بإدلب، هي أكبر مشفى للأطفال، وبنفس الطابق actually في مشفى تاني اسمه مشفى الأمومة. the reason there's two hospitals in the same building كان إنه they're all based on separate grants، كل مشفى sponsored by a special grant.
قديش كبرى ابن سينا اللي عم تحكي عليه؟
مشفى ابن سينا ال ICU to give you an idea is about 12 beds, pediatric ICU. And NICU is about 20 beds. The floor is very flexible. يعني there's a lot of rooms and they keep adding patients. وهلا إن شاء الله إذا صح لي بحط لكم صور عن المشفى والقصص هي كلها. مشفى الأمومة كمان نفس الشيء. فأول حملة يعني كانت مثل حملة استطلاعية بصراحة لحتى أشوف شو الوضع. يعني it was very tough ما كان في كتير شغلات متوفرة. نزلت معي my own laptop echo machine وكنا عم نشوف بين 100 ل 150 مريض كل يوم وكلهم complex cases. يعني بصراحة in 1 week I saw complex cases يعني اللي بيشوفها هون الواحد ب 3 months or 4 months even in a very busy cardiac center. بس بعدها يعني we felt إنه there is a lot that we need to do. So I came back, we started working مع الدكتور أمجد from the teaching institute, academic teaching institute، إنه ليش ما بنعمل fellowship to train the doctors، نعمل pediatric cardiology. They're already established pediatric residency، في عندهم pediatric residency, internal medicine, different other residencies، بس pediatric cardiology ما كان فيه. فرجعت لهون والحمد لله بلشنا نلم يعني مجموعة من الفاكولتي وعملنا لجنة تدريسية وبلشنا التريننج. نزلت couple of times after that، وفي مجموعة موجودة معنا بالجروب بس يمكن مو على الزوم. الدكتور باسل نرجس pediatric cardiologist نزل، والدكتور أحمد أصفري نزل. فكاريولوجيست نزلنا وقيمنا الوضع وبلشنا نساعدهم بالبوست اب كير. في عندهم يعني دكتور اسمه جواد أبو حطب هو بيعمل pediatric cardiovascular surgery، وعندهم الشلة اللي كانوا بمشفى الباسل وطلعوا سحبهم معه وصاروا يشتغلوا هنيك. فالسيتويشن كان إنه إذا بيبي بورن و very complex heart الحمد لله الجانب التركي they will take them and still to today's date. يعني هلا أنا إذا عندي baby born hypoplast truncus complex heart we transfer them to Turkey, they get their surgeries done and then they send them back. فعندنا الحمد لله صار we accepted, we did bunch of interviews, a lot of people applied, we took 2 fellows. وthey both ما شاء الله كان each one of them was a يعني رئيس مشفى. They left their position and they took the fellowship. Now we are in our 7th month of their first year. والحمدلله they're doing very good. فهي موضوع الفellowship يعني we started that. لما نزلنا بالميشنز يعني الميشنز لما بننزل نحن كجروب بالعادة قبل التحرير كنا ننزل multi specialties pediatric cardiology يعني based on who is available at what time. كنت أنا أنزل مع الدكتور باسل الأتاسي فكنا ننزل نحن مع بعض. آخر ميشن نزلناها بسبتمبر الحمد لله كان فيه تركيز على الأطفال. نزل معي الدكتور يامن صمادي عمل run his own GI clinic وهي did procedures وعمل lectures. نزل دكتور عمار قاطرجي pediatric and neuro. I had Dr. Greg Shea who came with me as well, pediatric pulmonologist. And we had Dr. Yahya كمان نزل بالبيد هيمونك. فالحمد لله نزلنا we did the first يعني SAMS sponsored pediatric conference. It was a 2-day conference. Can lectures in the morning, workshops in the evening. فأنا مثلا to give you an example of my workshops, I gave a workshop for the OB doctors how to do fetal screen, to detect congenital heart defect. I did how to read an EKG, a workshop how to teach to read an EKG. I did a workshop for ER doctors, how to pick up on arrhythmia, differentiate, how to approach them, triage them, So basic stuff that there was a huge demand for. We kind of felt, asked them, we did a survey before, what topics you want, what workshops you want. فالحمدلله يعني it was successful. Dr. يامن عمل لهم workshops كمان بspecialty وجريج وعمار ما شاء الله. It was good يعني الحمد لله. When we go on a mission يعني كنا honestly ما بننام يعني معظم الوقت I never go back to my يعني place of stay until 1 or 2 in the morning. We are super excited. We work non-stop, فالحمد لله it was good. It was a great experience. I wish inshallah يعني in the next few months to a year or 2 we can build now on that يعني with all the group, with all the specialty. يعني we hope with SAM's umbrella we can go in and we can help a lot. And there is so much need for all of you in all the specialties as you can imagine, and how much we can do inshallah. Later يعني I can explain more if anybody asks any questions. But in brief يعني the mission was amazing. You can leave an impact. The better impact is when you teach them something, and then follow up on it. And even after I came back, a lot of consults on the phone. Can you see this? We FaceTime. We go over this and go over that. Besides my fellows يعني. With our fellowship, yani, we have 12 dedicated faculties, alhamdulillah. We round every day with the fellows, and we review all the echoes they do in there. If I'm on call during this week as an echo on-call person, at the end of the day, they send me all their images. I review them, give them my feedback. We go live echoes. If there is a baby who's suddenly arrested or suddenly born cyanotic, they need somebody right away, we jump on it, alhamdulillah. Or if I'm tied up for whatever reason, I'm in the EP lab or I'm in the clinic, the faculty jump in, alhamdulillah. They're all very helpful. And after Taharrur, the other thing we did, alhamdulillah, a lot of us were hesitant about joining SAMS, for all these obvious reasons, خايفين على الأهل وكذا in the south. A lot of people, alhamdulillah, expressed interest in joining the cardiology team. We added more faculty, alhamdulillah, and we added a couple of surgeons even, Syrian trained and practicing here in the US. We even reach out to the surgeons and the cardiologists in Syria, and we established our own رابطة, for أطباء القلب وجراحة القلب في الداخل والخارج. We added all the local surgeons in Syria with cardiologists, with cardiology attendings, because of محافظة. We even added some of the cardiologists in the Gulf countries, Syrian. Recently, we're reaching out to the UK guys. We use it as a format to socialize, to communicate, to discuss cases. And I'm happy, for example, today one of the surgeons there, he presented a case, very rare case of aneurysm in the LV, congenital. He did a surgery. There is 100 case reported in the literature. فكانت good discussion, يعني, alhamdulillah. We had a Zoom call with them. We talked about their needs, what's going on. Alhamdulillah, صار عندنا better assessment and idea of what's going on there. يعني, what do they need, what's missing, and things like that. But that's in brief. يعني, I hope I didn't go over time. I'm not looking at the time.
2 minutes. 2
Okay,
minutes.
يلا خلاص. I'll stop there.
الله يعطيك العافيه دكتور خالد. لا ان شاء الله في لك وقفه ثانيه، في لك سلايد ثاني ان شاء الله. الله يجزيك الخير، ما شاء الله عنك، يعني يو ريز ذا بار سو هاي. والشغل اللي عم تشتغله بالكارديولوجي وبشكل عام بالبيدياتريكس والله شغل بيرفع الراس. الله يجزيك الخير.
تسلم.
طيب هلا حننتقل هلا للدكتور محمد الحصني، هيحكي لنا شوي عن الاكسبيرينس تبعه بالنيكيو بنورث ويست سوريا وبشكل عام. يعني هلا بعد التحرير الحمد لله شلون بدها تكون، يعني شو الفيجن تبع السامز وشلون فينا نساعد لحتى to expand this experience to all the across Syria، مو بس يكون بس بالنورث ايست نورث ويست. تفضل دكتور محمد.
مساء الخير جميعا. Good evening everyone. Before I start, I'm just trying to share my screen.
Yes, I stopped sharing, so you should have access now.
All right.
Try to share it again.
Can you see it now?
لا لسه. راح لك دقيقة من 10 دقايق. No pressure.
ياخذ وقت خالد بعدين.
ايه خلاص.
Take as much.
All right, let's try this again.
Yep.
Can you see it now?
Not yet.
All right, let me exit and try this.
Yeah, I was gonna ask you to do the Syrian style.
وردك الباب. كيفك باسم؟ دكتور باسم معنا؟
السلام عليكم. الحمد لله. Doing well. تحية للجميع.
السلام عليكم دكتور باسم أستاذنا الغالي.
باسم دك الباب. Pediatric endocrine from Detroit. Sorry, I didn't introduce myself.
And دكتور باسم.
Hello, Basim. I think now we should be able all
to see. Yeah, we
see you.
can see it now.
All right. مساء الخير جميع. Good evening, everyone. Thank you, Majd. Thank you, Khalid. And thank you, everyone, for attending and joining us tonight. I'm going to speak in English, so it's easier for everybody to understand. And I'm sure I'm going to use Arabic words here and there. So it's very exciting times for all of us to come together, be part of this great initiative, and hopefully we can make an impact and care of our Syrian kids. So I'm going to present to you a quick overview of the neonatal service that SAMS has established in northwest Syria. I will conclude with briefly sharing a few observations from the ground from Syria and a few food for thought points about how we can use this experience that we had with the neonatal services after the liberation of our beloved country, Syria. So the neonatal service in the Northwest area started in 2017. SAM was invested in establishing a neonatal care. Obviously, this was based on a huge need for such a service. There was a lack of any established newborn service in that area. And on top of that, there's a high volume of deliveries that happen. So it was definitely a much needed service. SAMS sponsored one hospital at that time. It was called Idlib Maternity Hospital. It was in the suburb of Idlib city. And we had a small NICU with 4 beds and 6 incubator. This is photos of the first unit that we had in that hospital. And if I remember correctly, it used to be called Al-Majd Hospital, but it was transformed later to Idlib Maternity Hospital. And you can see it's a small room, it's narrow, not much space, a little bit overcrowded. So that was the start. And then fast forward to 2024, SAMS now has 3 main maternity hospitals that they sponsored, with about more than 20,000 deliveries that take place in those hospitals. We have 4 NICUs currently that are sponsored by SAMS. Ibn Sina Hospital with about like 15 total beds, 10 ICU beds and 5 incubators. We have Mashfa al-Umumi, our maternity hospitals with 9 ICU beds, 15 incubators. Adana Hospital, which is close to the border with Turkey, 5 NICU beds, 5 incubators, and Qah, 4 ICU beds and 10 incubators. So currently we have a total bed capacity of 28 beds and 35 incubators. So major transformation in the neonatal service that we have over the years. This is just to show some pictures from the current hospitals that we have. You can see it's more spacious, better equipped. So really very proud of having those NICUs that we established. So the big question, how did we achieve this? Well, it was accomplished by really having committed physicians and members that worked diligently with SAM's leaderships and with the SAM staffs inside Syria. We also collaborated very importantly with the healthcare workers and the staffs on the ground. We did get their buy-in. They were very highly interested and very eager to learn and get better. So again, SAM provided the logistics, took care of choosing hospitals, building units, applying for grants, so we can have a long-term continuation of the programs and financial support. And at the same time, we have a core pediatric ICU teams where we provided the education, the training. We did training courses for different skills. We did TOT or training of the trainer type of courses. We did web-based lectures. We did in-person lectures and case presentation and case discussions. We provided, like Khaled mentioned, virtual consultation and supervisions for the physicians and the staff there. And as I said, our target audience was the healthcare workers on the ground. So we targeted physicians, mainly pediatricians and some obstetricians. We worked with the nurses, the midwives, technicians. So really got the buy-in from the staff on the ground. As I mentioned, we established and conducted 4 neonatal training courses between 2017 and 2018. It was mainly done in Turkey, Gaziantep, with the staff from Syria coming and attending in person. And we did multiple workshops, as I mentioned, and training courses and lectures and case discussions. Some of the topics that we covered: delivery room management, basic and advanced neonatal resuscitation skills, workshops and training sessions, basic and common problems in the neonatal field. One project that we really we're very proud of is the introduction of the bubble CPAP to most of the NICUs. This was really a good initiative where we did the training for the physicians and the staff. We established some guidelines for them, and it was a huge success, and it helped make really a big difference in the care of not only preterm babies, but term babies with respiratory distress. So this was a really big success overall. Some pictures from the neonatal training courses that we did. This was the first course we did in Gaziantep in February 2017 with the trainers being involved, myself, Dr. Mohamed Maalim, and a friend from Canada, Usama. So that was the first one. This is some photos about the workshops and the hands-on training and skills that we did. As you can see, it was different type of healthcare workers. We can, like nurses, midwives, and physicians, as I said. And again, they were all vested in this and very eager to learn, and they were like a sponge absorbing all the information that we were providing for them. What was more important is that those trainees, when they went back to their local hospitals, they conveyed the training and the information that we gave them, and that was the whole purpose of the TOT courses that we provided to their local staffs. So we were very happy and very proud and excited to see that happening. So you can see how the local physicians and even the midwives went back to their clinics and their hospitals and shared some of the information that they received over there. So again, the buy-in from the staff and their commitment and their eagerness to learn, I mean, did really make a big difference along with all the other stuff that I mentioned. So right now, I mean, I can proudly say that a 32, even 30-weeker can survive really without any significant complications in most of the cases. So that was really a big achievement that we had. So moving forward, we now have bigger geographical area. We now have the whole Syria with its different cities. And it is not the same setup that we had in Idlib. It definitely has its own unique differences. I'm sharing here with you some of the observations that were noticed. It was based on some visits. Some of our colleagues and members have done to the Children's Hospital in Damascus and in Hama. For the most part, I mean, those probably mainly pertains to the neonatal service, but I think it can be likely be the same for other pediatric fields and specialties. Again, this is just sharing some of the very preliminary observations observed. So hospital buildings are old, not maintained well, and it's probably going to be very challenging to renovate. The nursing staff is another issue. It's scarce, and the quality of nursing care provided is definitely an issue. Infection control measures are not very well established, and there is a scarce of hand sanitizers, and half of the supplies are not there. There is a lack of essential equipment and supplies and consumable, and most of you have heard that this is getting a great attention currently. And I know the Ministry of Health, along with other health care organizations and humanitarian organizations like SAMS, are trying to address those acutely and urgently to keep some of the services going. There's lack of management protocols and guidelines, and more importantly, the education and teaching for the resident is very poor, to say the least. There's a lack of supervisions from the faculties, and it's basically the education is done by the residents themselves. The fourth and the third year teaches the first and the second year. So moving forward, we have to start somewhere. And I believe we need to have members and physicians from our group getting involved, taking initiative and participate with this process. This hopefully will be structured under a very organized teamwork and more importantly, in collaboration with the local health care or Syrian teams. And I think their buy-in is crucial and important. And I believe it can be done. It's obviously going to be a great task, and there's going to be some challenges that we are faced with as we move along. But I believe our meeting and getting together is a first step, and we are hopeful, inshallah, that this would be a start for a great collaboration and working together in the long and the short term, not only the short term. And I think, and I'm hopeful that we can really work together, collaborate together, and make a difference and impact in the care of our Syrian newborns and children. I would like again to thank you for joining us, and I will stop here and send it back to Majd. And of course, I'll be happy to take questions later.
الله يعطيك العافية. الله يعطيك العافية دكتور محمد. إن شاء الله كل الأسئلة حيكونوا at the end of the discussion. We'll like at the during the discussion. Dr. Tarif.
I just want to say a few things. One, Dr. Mohammed, if you can talk about the fellowship, and it's important to tell people that we work in different settings. Like you started the fellowship with under other organization support, well, they're a SAM member. It's very important to tell people that we want to work with everybody else.
Yeah, thank you, Tarif. I mean, so similar to, I didn't want to spend a longer time talking about this, but just briefly to mention, I mean, similar to what Khalid started in 2023, in 2021, we worked with another health care organization in establishing the same thing, training a few physicians that were specialized in pediatrics in the field of neonatology. And it was a virtual type of training where we had like a core group of neonatologists who were invested in this. Similar to what Khalid has mentioned, we did have a selection group from a different pediatrician who applied for the physician to the position. We had a curriculum that we covered. We provided consultation. We were taking care calls and providing sometimes virtual rounding. And the fruits were graduating 5 physicians who have really have specialized in the neonatal field. It was definitely a unique experience. So yeah, I mean, that was done in collaboration, as I said, by SAMS members in collaboration with other organizations.
Which brings a fast point I want to say also, Majid Smahli. You guys have all passions, right? If your passion is education, please follow that passion in helping Syrians. If your passion in research, please the research passion. If your passion is serving, please do the serving. Everybody has a passion, so please bring that passion to the table. I'm done.
Good point.
الله يجزيك خير. Yeah, that's very important. الله يجزيك خير دكتور محمد. والله ما شاء الله شغل جبار جبار، وإن شاء الله نقدر نحول هذا الجهد كله تحول لصورة كله بإذن الله قريبا. الله يعطيك العافية. All right, next we'll go to Dr. Nidal Waher. He's a board member now. I think good number of us now in this meeting, they're not SAMS member. They know probably a little bit about SAMS. So Dr. Nidal will tell us more about like the structure of SAMS, the society and the foundation, the membership, how to be a member, what's the benefit of membership these days. تفضل دكتور نضال، الميكروفون معك إن شاء الله 10 minutes بإذن الله. تفضل.
Okay, إن شاء الله. مساء الخير يا جماعة. Good evening. Thank you for joining us on this Monday evening. So أنا بدي أحكي شوي على الستراكشر تبعت SAMS وعلى الممبرشيب. Give you some number about SAMS. نقدر نبدأ بالسوسايتي. Difference between دائما شو difference between society and foundation. SAMS established 1998 by a society of SAMS. It's mainly for conferences, for members, education. Few years later, with 2007, a charitable arm of SAMS, the foundation, was established. was like small function till after 2011, when the foundation significantly expanded for all that medical humanitarian services that Dr. Khalid and Dr. Ahmed mentioned, بالغوطة، بحلب، بنورث إدلب، بمناطق كثيرة بسوريا. Society, on the other hand, basically you have a structure, it's elected board member. They change every 2 years by election from the active members. Mainly it's take care of the membership, of the education, of the research, conferences, advocacy. So that the society in a nutshell. The foundation board member expanded recently to 11 members. They get appointed by the society, and basically they take care of all that medical relief. Also, some advocacy overlap with the society. Try to have separation, like the people who take care of the money and finance aspect in the US, as you know, need to be separated. With foundation, any donation in foundation is tax deductible. Basically as any charitable organization. بالنسبة للtype of membership, right now we have 4 different types. The full member اللي هن physician, pharmacist, dentist, allied healthcare. So basically anyone in the healthcare, let's say nurses, physical therapists, speech therapists, etc. هدول كلهم under a full member. They can vote, they can run for the office and the board. And next will be in training members, which basically the students, Syrian student or Syrian descent medical student or healthcare student and resident. وفي affiliate member, هدول medical professional, however, they are not Syrian or not American. So your neighbor, let's say Egyptian doctor, believe in the cause of SAMS, they are more than welcome to join SAMS. Or if you have Syrian doctor in Germany and they believe in SAMS mission and vision, they are welcome to join SAMS as affiliate member. Recently, the most recent category that we added, Friends of SAM. This is basically your neighbor that has nothing to do with the medicine or medical field, banker or grocery or electrician, teacher, but also they believe in SAMS. They could join SAMS and be friends of SAMS. As of like tonight at 8 o'clock, we are up to 1158 member. MashaAllah, in the last like 6 weeks, our number went up by 50%. We have 854 full member. We have in training between student and resident 264, affiliate 14, and friends of SAM 26. هاي category by specialty. Medicine or internal medicine, basically they are the major player, had 491 member. Pediatric or pediatrician 79, so 79 or 80 out of 1100. So we are very small, we have a very small percentage of the total SAMS member. في عندنا surgery 41, OBGYN 19, pathology 21, radiology 15, pharmacy 13. I didn't add all the category, like the pie circle chart would be very crowded. But just I picked up these. So pediatrician, right now we have 79 pediatrician, general pediatrician, and subspecialty in SAMS. Subspecialty also I try to over not every subspecialty, so I'm sorry, Dr. Tarif, neurology, not there yet. But في عنا pulmonary, 2 pulmonary, 3 ID, I think 2 of them with us. Nephrology, we have 3, PICU, we have 7, NICU, we have 2, endo 2, and cardiology 6.
No gastro?
We have gastro, but I'm not sure how many active. How many full members.
على جماعة الهضمية شوي.
Yeah, we have too many in the group, but I'm not sure if all of them member. So this is like subspecialty. So almost in every subspecialty we have member, but as you see, number they are very shy. البنفit what يعني المembership committee try to provide benefit and the society provide benefit للمember. Education بالconferences, we have 3 conferences a year, usually 2 in US and 1 international. This year, international one going to be in Damascus in July 4th to July 6th. You earn CME. We have our monthly webinar every 4th Thursday of the month. I don't know if some of you have been joining that. Usually it's non-medical, and if it's medical, it's for something interesting for everyone. Like last Thursday, we talk about weight loss and fasting. Yeah, something majority of members they may have interest that topic. Usually, also we talk in the past about flight emergency if you are in the airplane, or finance, 101 retirement, etc. You have research opportunity with the research committee. We have very active research committee. You could publish your article at SAMS journal, which is Evansina, Journal of Medicine. Volunteering opportunity, obviously medical mission, specifically tailored to the member. They have priority to join this mission. Outreach in the community in US by joining like free clinic. Support for medical students, the education committee, and I think Majd, you are part of this, right? They do outstanding job every year, including all these programs: mentorship program, hardship, interview skills workshop, resume advice workshop, observership program. So this for Syrian students, they are coming to US or came to US, and they're gonna try to join the residency program. So they help them from A to Z. They have their own YouTube channel. Honestly, when I open that YouTube channel, it's like they pick you up basically from the airport. They tell you to do everything from the airport till you join that residency program. And they have over 250,000 view, I think, on that channel. Leadership opportunity, obviously, you have the right to vote and run for the board, be involved with the committee work, award and grants at national and international conferences. Monetary benefits, which try to summarize. Top one would be up to 15% when you use Turkish Airlines through Adam Travel. You have lodging discounts up to 40% or even more during conferences. For example, Orlando conference in 3 weeks. I think the room $280. If you try to buy it online from the website, would be like 600 plus. Medical equipment company, 15% off. We have immigration lawyer. He will give up to 20% discount. And SCAFCO, Rad SCAF with free comprehensive financial planning at your service. Now that was what SAMS will provide. However, we've been asked, especially in the last few weeks, what can we do? Why should we join SAMS? How can we help Syria through SAMS? So the membership committee came with this initiative, HEAL initiative, humanitarian support by going in medical mission and helping these kids, either by treating them during the medical mission directly, or try to educate the provider or train the trainee basically by the education. You could do that in person or virtually. Advocacy could be just word of mouth, telling your neighbor or your co-worker about SAMS. Could be going to your congressman, congresswoman, the Senate, but try to get to grant and help to SAMS. And leadership. SAMS in need of like a new generation, a new blood to take that ladder and be involved in the leadership in SAMS, try to help the organization. And last but not the least, this is just like for our conference in Damascus. Hopefully all of you will be able to join. Going to be July 4th to July 6th in Damascus, the main conference. It's going to have a lot of other activity. Going to have medical mission prior and after to the Syrian cities. Going to have the SAMS Scientific Week prior and after, also to the Syrian cities, Halab, Hama, Hamas, Ladiyah, Dimashq. Also, we're going to have a hands-on workshop. Dr. Anas Mahrabiya, he's well known to the ICU community. He will be dealing with that. And if you're interested in pediatric, to do similar things for the nurses, for the residents, that would be a great opportunity to do so during that time. Thank you for joining us tonight, and I'll be happy to answer any question at the end, at the QA session.
انا بس بدي يعني ارجيك، انا ممبر، وهي ليك الويلكم ليتر من دكتور هي هويتي يعني. بس
ميت السلامه.
بس لا معناتها الداتا فيها مشكله اخي نضال، يعني بجوز في كثير members not counted for
لا الممبر counted، بس انت جي اي انا it's hard to have all the subspecialty.
الجي اي والنيورولوجي مو محسوبين سيدنا.
اجراف على راسنا، البرين هو control everything.
نضال بس شغله مهمه لو سمحت. Can you
تفضل.
talk about what can we do as a pediatric group during that conference, the big conference? You said that we're going to have visits to other hospitals, other cities, right? We have time to do things for pediatrics. Is that correct?
في هلا we could do like 3 things at least, or 4 things. في scientific week prior and after in the Syrian cities نقدر نعطي lecture, and this is going to be under SAMS Institute, so we could arrange مثلا تعطي lecture بحلب, and this open access for everyone could attend this lecture be all the Syrian city. بالconference حكيت أنا مع خالد about that, we could do what we called parallel session in the afternoon, Saturday and Sunday. نقدر نعمل parallel session just for pediatric, a group of speaker. We can have up to 6 hours, يعني plus minus, in 2 days, 12 lecture. And this will be for people who register to the conference from US and from Syria. So the access is not wide open, لأن the place cannot accommodate everyone, obviously, Syria. Third things, the medical mission. They're going to be under the medical mission committee, going to be medical mission to Syrian cities. We could arrange pediatric mission. Well, last but not the least, what's very, very important, I think, is workshop, hands-on workshop. Yani to teach the nurses how to start IV, or Muhammad how to intubate neonatal preemie, or GI how to do scope, yani cardiology how to read 12-lead EKG, as simple as that. Yeah.
Excellent, wonderful. Some points on the chats, by the way. Dr. Shea said interesting points. One, that we need to train nurses in NICU, PICU, and that we need genetics help, definitely, and I agree with him on that. And so definitely we talked about nursing training, recently in our committee, if you guys recall. Mashad, what should we do next? You're the boss.
Inshallah, we'll go over the questions at the end, bismillah, based on specialty. The committee will answer the questions, inshallah. Next, we have Dr. Khalid, but I want to share video for less than 1 minute. It was a case that Dr. Khalid saw in Idlib. I will share the video, just like 1 minute, and then inshallah we'll go over the next slide. All right, can you see my screen, guys?
Yes, yep, we can.
All right, so we'll share the video. Dr. Khalid will talk to us about this patient for 2 minutes, and then we'll jump to the next slide.
بلال من الأطفال اللي شفناها بإحدى المرات، فعم نعمل له تخطيط قلب وصورة طلع معه severe vegetation. صور الإكس-راي عم نقراها طبعا on the window, huge large heart. وطلع عنده big vegetation على الميترال valve، فكان بده mechanical valve، وكانت التكلفة تبعه كبيرة، الفالف والسيرجري. what we did, alhamdulillah, when we came back here, we did a GoFundMe, and we raised $11,000 for him to cover his cost. We took him out. هي one of the refugee camps كنا فيها. عملنا غرفة للإيكو، غرفة للEKG. Just to show you an example, يعني شوف, we went in and did screening for all the kids, at that time. But just to show you stuff you can do, يعني any of you can do it, inshallah. So going into discussion, which part I'm talking about now, Majid, the fellowship, or you're muted, Majid.
Sorry, yeah. So
Yes.
now, Dr. Khalid, you're going to talk about the fellowship and the current project for you guys.
Tamam. So, and I mentioned a little bit of the fellowship, inshallah, and you got a good idea. When we started the fellowship, it was a concept, yani hard to realize it. You know, how do you teach fellows how to do an echo, you know, remotely, virtually? It took some while, it took some practice. We went there 4 times between me and the other attendees. Well, alhamdulillah, yani, even another group, another mission group came up and worked with our fellows, and they were impressed, alhamdulillah. And in 6 months, their level, mashallah, you guys already know this. Yani, mashallah, shabab Suria, they read a lot. Yani, their book knowledge is amazing. They read quite a bit. But the technicality will applications, will protocols, will categorization and how to apply it, sometimes that is missing. Alhamdulillah, بالفellowship, yani, we established with them a process. Like I said, we are on call with them. We review their echoes, and we have now just started with them journal clubs. We picked a book for them to read. We did an assessment, and the first test we did for them, they scored 80%. Yani, that's really tough with an English book, you know, American book. But that was tough for them. Yani, when I was in the conference, I forgot to mention, we made them do abstract or posters. So that was great experience for them as well. First time writing an abstract or putting a poster up there. وعملنا مثل small poster session on the side of the conference, and I think that might be a good idea for our scientific يعني conference inshallah planned this July. We can do something similar. When I came back with Dr. Ammar Qaterji, we started planning to put a neurology, pediatric neurology fellowship. We pulled Tarif and other peds neurologists, and subhanallah, we were planning to start this of January this year, but then this thing happened, so we are on pause until we figure out what to do next. هلا أكيد to transition to the وضع بسوريا, you all know situation is very desperate, is very dire. كلياتنا شفنا we all saw the hospital pictures and we talked to a bunch of doctors. I've been talking to a bunch of people in Hama, in Ladhiqiya, and in Damascus about the situation. I've been involved with pediatricians outside the hospitals. You'll be impressed to know there is a group of 1,000 pediatricians out there in Syria, in Damascus and Aleppo. They grouped themselves, and they're trying to find ways to improve the pediatric healthcare, you know, in Syria. They got me pulled and say, how can SAMS help us? How can you guys help us with that? So I think our goal should be to try to help as much as we can. We cannot be their healthcare system, and we all reach that conclusion. The Ministry of Health, يعني الوزير walked into this situation and saw the disaster. They've been pulled in so many directions. مديرة مشفى الأطفال دكتورة ديانا الأسمر, she doesn't really sleep. She's working nonstop. People come and go to her office. She's overwhelmed with so much need. There is a huge lack of medication supplies. And you probably saw from the post, يعني SAMS, alhamdulillah, the first thing we did, we send them a 25,000, and then we send them another 50,000. Wazir al-Saha recently reached out to us, to SAMS, and asked for help to buy them oxygenators. So alhamdulillah, they were able to buy, you know, that for them for Mashfa al-Muwasa and Mashfa al-Atfal. So they dispensed $90,000 for that. There's other project. When I talked to Dr. Diana, Yani, her main question was, you know, there's so much to tackle. She asked for help in the ER to help them with triage in the ER. So we have a team right now in Syria, alhamdulillah. Dr. Amir al-Husseini is helping them. He's already there. I talked to him yesterday, mashallah. He's helping them set up some process, so to speak. They wanted help with PALS and NALS, you know, resuscitation certificate. SAMS has a simulation lab. They really invested heavily in that in the north. And we made all the doctors, or as much as we can, go through that. So alhamdulillah, yani we plan inshallah to apply the same for the people in the south and invite them to come up. We cannot, we have to be careful not to go on our own and just reach out to different places and just think like they will let you do whatever you want. We have to understand they all have to answer to the Ministry of Health. And any organization outside of Syria or even in Syria, non-profit that wants to do something with any of these medical centers or hospitals, they have to go through a special office. They set up a special office with Dr. Zuhair Qarrat. He's in charge of it. And we have to go in and do like a muzakarat tafahum ma'hum. It has to be approved, and then we can go in. So I think, inshallah, SAMS will provide that umbrella for us. It will help us. You can't imagine, yani, we can't, any of us cannot go there and practice on his own unless you get a license, you get, you know, go through like any doctors in there. And even though you cannot just walk into any hospital and do whatever. So we have to find the umbrella that will help us through that. So one of the things we kind of started to work on, and many of you are involved in that, alhamdulillah, already. One of the huge demand or need for them is a CT scan. The Children's Hospital, they need a CT scan. So we, SAMS have looked with Dr. Ihsan, one of the radiologists, looked at options for them, and they wanted a brand new one. So we picked one from a local vendor that can provide, inshallah, yani maintenance and support and all of this. So the cost of that system is going to be $200,000. So in our other group, in our Damascus group, we alhamdulillah raised almost, how much, Majid? 130, 135?
50 now, I think. It's 150.
130. 130. We are
130.
130.
So alhamdulillah, we were able to reach 130. So maybe we can, you guys can help that group. You can help us, inshallah, to chip in and help yani, as much as you can. And we can put the link for the donation. It's going through SAMS. So this is not and you would get a tax benefit to it and all of that stuff. And then the other thing, we promised them another 50,000. So Dr. Amjad has put in a link for that donation as well. So if some of you doesn't feel like the CT scan is super important and he wants to chip in other, you know, options, like we hopefully will be able to see what they need the most and what can we provide to them. Urgent medication, because that's the number one they're asking for, is urgent medication, urgent supplies, يعني even a syringe, you know, from that stuff.
Khalid, there's actually a question on the chat.
Yes.
Dr. Ali says العمل لمشفى الأطفال في دمشق مشكور. هل من جهود جادة للتواصل مع المحافظات الثانية المنكوبة دير الزور رقة درعا؟
تمام. In Dar'a, I am involved in that group as well. And one of my partners in crime, Dr. Jihad, he's involved in the group with Deir Zor. I'm not sure about Al-Raqqa, to be honest with you. Raqqa is not under is under Qasad. So I don't think we can even be involved in that until that situation is resolved, you know. But the hospitals that we've been to as SAMS is Aleppo, the Homs, Hama, Laziqiyya, Damascus. I'm not sure. Dar'a also, you know, there is a group of us that went to Dar'a and assessed the situation. And we can link that group. If one of you want to help on that group as well, you're welcome to join.
So Khalid, you know, I just want to say important points briefly. And I think the chairman of the foundation is with us today, right?
Yes, Dr.
Just one second, I'm going to say, guys, work with National Public Radio. I've been on NPR a few times. wrote a book about what happens here. If you can write a book, please write a book about experiences. Ustaz Ali Farzat helped me with the book. He even had the characters in the book. It's taught in university. So please think on the level of how can you spread the word. The more we spread the word about the suffering of the Syrian people is going to help us a lot. So please think about what can you do to talk to even like local TV, radio stations. If the chair of the foundation has time for us, please, if you want to say anything.
دكتور عبد الفتاح معنا.
I know that.
Yep.
تفضل دكتور.
I just texted him to yeah, you got back to
يلا
me.
السلام عليكم جميعا.
تفضل دكتور فتاح.
اهلين حكيم
اهلا
نورنا.
وسهلا اهلا وسهلا الله يعطيكم العافيه مساء الخير ما شاء الله عليكم الله يعطيكم العافيه جميعا. What's an honor to be with you all. يعني this is so a blessing to see all of you ما شاء الله with the excitement, readiness, and you know, to help the children of Syria, our children there. So there's nothing more rewarding really than having you with all the energy, the enthusiasm that you are interested in providing any support that you're able to for the children of Syria. So we are so honored to have you. And on behalf of the SAMS Foundation and SAMS as well, we thank you all for all what you've done for Syria and what you're planning to do as well. I was honored to visit Syria 1 week after the liberation. I was in Damascus on the 16th of December. I had the chance to visit the Children's Hospital in Damascus, and I met as well with Dr. Diana at the time. She was the vice president at the time. She wasn't the president yet. I had the honor as well to meet with doctors in training. And it was so nice to see Syria, so nice to visit, but at the same time, you know, it's so painful to see the need that's there. I mean, the challenges at the Children's Hospital, for instance, when I was there, and we were told that you know, for example, the nursing staff, the hospital is running at 20% of the nursing staff, only 20%. And the remaining 80% of the nursing staff are not there. So just imagine, you know, how would a largest hospital in Damascus that really provide care for children capable and able to run with only 20% of the nursing staff. Not just that, in terms of medication, in terms of consumable, they have limited supply of everything, what we were told. And then one thing that really shook us all when the doctors in training said, you know, when a child needs to have a central line, most of the time, unfortunately, those children may not make it. And this is really where your expertise in terms of providing support and training for these young future doctors makes a big, big impact, really, in saving life. And, you know, when you save a child, I mean, this is your expertise, really. When you're saving a child, there's nothing more rewarding than saving a child. I mean, saving one human being as saving all humanity, as we've learned as well in our Quran. So this is a blessing, opportunity. I mean, definitely there's so much for us to do. And on behalf of the foundation, we are here to support you in anything that you need. So just anything is needed would be more than honored to support you in terms of logistic, in terms of traveling as well, and then medical mission, as we are coordinating that, and there's so much interest in that. We have a team in Damascus already. SAMS Foundation, we already established 3 offices. One office in Damascus, where the headquarters of SAM will be in Damascus. We established an office in Homs. We established an office in Aleppo. So these offices for the moment will address the northern part of Syria, the central part of Syria, and the southern part of Syria as well. In addition, we are as well looking into establishing an office in the coastal in Latakia to address the need there. So we are here and for your service. Anything you need, we are here to support you and provide you anything is needed. So I'm honored and humbled to be with you here this evening, and I would like to thank all of you for everything that you've done for humanity, especially for the children. So thank you again, and God bless you. MashaAllah alaikum. Allah ya'tikum al-afiyah jami'an.
We have one point to tell you. A lot of people would say that, you know, more than 50% of the Syrian population are going to be children. And we know that, right? More than 50%, almost children. So the point is, how can we in SAMS put as much effort actually in supporting the children of Syria? And since they make 50%, maybe more of the population, what do you think of that? How can we move forward and further maybe in supporting the cause of children in Syria?
Well, I mean, this is definitely, we are more than willing to look into what else can we do to support the children. I mean, just like, for instance, when we looked at the children's hospital in Damascus, and then just recently they asked us they need oxygen. So we've provided that. They need now, it was brought to our attention, they need the CAT scan. So the board said, okay, let's go ahead. We approve that. Let's initiate the fundraising on it. So we already exceeded 50%. We've said we need consumable medication. We said, okay, let's approve fund for that. So it's already in the making as well. So there's a number of projects already in the making, and we are more than interested in, as an organization, is really the pediatric population. I mean, there's no doubt they need a lot of our help, and we are committed to do that. Just keep in mind as well, as Dr. Khalid mentioned earlier, we are not the Ministry of Health as well. And SAM, as an organization, we are unable to fulfill all the need of the children, the pediatric population, or the adult as well. But we are committed to provide whatever is this organization is able to do, and we will be able to support you as anything that you come up with in terms of project. We'll be more than happy to support you with any project that you are able to come up with, and any donation, any fundraising that you do for the purpose of the pediatrician, it will go for that purpose as well. So there's definitely a lot of opportunity, and we are here for you to serve you.
Thank you so much. I mean, it's wonderful. Thanks.
And the good thing, alhamdulillah, what they did, if we can, that pediatric, I don't know who's unmuted, but what we did for we created that link for donation just for pediatrics. The board, alhamdulillah, agreed to match it. So whatever we raise here, it will be doubled by the board, yani contribution, inshallah. Yani this is a good way for each of us to help the other out, inshallah. So keep that in mind, and we can, as we go along, we can see what projects we can help with. Just like the education, the pediatric conference, the missions. One of the things I didn't mention, I'm being EP. I worked last year with the EP adult group. We established the first EP lab in Syria, biplane lab in Idlib. We did the first ablation last September, alhamdulillah. It was amazing for us to do 3D mapping, just the same stuff we do here. We have it in Idlib. We have an excellent center, يعني ما شاء الله بمشفى الزراعة. So just to give you an idea, our cardiology committee, we set up a plan for the next 3 months that every week or so, one of us is going to be there. Cardiology, structural, pediatric cardiology, EP. So inshallah, for 3 months after Ramadan, we're going to have somebody there around the clock to cover service, to provide free service and we're starting to see, like my pediatric cardiology clinic, we're seeing people from even Deir ez-Zor. I have patients that come from Deir ez-Zor. The other day, I have a kid came from Qamishli. I don't know how they came, but they came from Qamishli, and the surgeons who are there, we're talking to them about even bringing them up to our center to do the surgeries there. So inshallah, we can help those kids.
That's amazing what you're doing. We see questions and answers. Please, anybody, please feel free.
طيب أنا فارس البيطار ممكن المداخلة بتوقع الوضع يعني كلكم تعرفوا هالشيء بس الوضع مختلف بين ما اشتغل وقت كنا عم نشتغل مع إدلب وبين هلا يعني مثلا أنا حاولت زيارتي القصيرة إنه فوت على البيدياتريك ICU بمشفى الأطفال. يعني في عنده الدكتور المختص هناك من بريطانيا الزلمه ويعني بالنسبه لخبرات الدكاتره متوقع موجوده اكثر ما كانت يعني بإدلب كانت تقريبا معدومه بس التنظيم الميديكال كير يعني انت كلياتنا بنعرف بس والله يعني بالنسبه لمستوى الدكاتره كثير ناس بتخرج من اوروبا ومن امريكا ومن دول يعني ممتازه بس الميديكال كير ما عم يتحسن لانه لا النيرسينج عم يشتغلوا ولا الفنيين عم يشتغلوا مزبوط ولا في سيستم بالمشافي يعني هذا بدنا نحاول نركز عليه هلا يعني بشكل اساسي بتوقع يعني انا مثلا كنت عم بسالهم شلون النوبات تبع النيرسز بيقول لي 7 الصبح و3 المساء حتى لما دققنا اكثر بمشافي ثانيه طلعوا الثلاثه اللي بيشتغلوا المساء بيتناوبوا يعني والله 2 بيناموا واحده بتشتغل وبعدين بيفيقوا بعض يعني مو انه والله ratio patients to nurse. عرفت علي؟ يعني هذا بس just one simple example. فهي الشغله يعني we need to have a system، وهي ما بتوقع الدكاتره ممكن انه تساعد فيها بشكل as much as والله having nurses and technicians و respiratory therapists. يعني لما فتت على اليونت كل الفنتليترز اللي قدامي فيها الارم شغال، وواحد بيقول لي شيء اكسجين سنسور مو شغال، وواحد بيقول لي التوبينج تبع الفنتليتر they have to use another patient's tubing لانه ما عندهم كفايه من هالشغلات. هلا هي الشغله الثانيه ذكرت انت الاكويبمنت والسبلايز. نحن اشتغلنا هون، اذا ما بعرف اذا حدا منكم بيتذكر medical bridges، وكنا نحمل كونتينرز هون من هيوستن. we have the largest medical center in the world هون. نحن بنفوت على مشافي كبيره يعني عملاقه، وبنحكي معهم وبيعطونا supplies that they don't need in the hospital. بتعرف كل فتره they have to renew their equipment. بتاخذها in fraction of the price. يعني اذا مو نص السعر بتاخذ والله 30-40% from the price. وتخوت يعني انا بقول لك تخوت اللي هن هدول ما بدهم اياها المشافي احسن من اي مشفى شفته بالتخوت بالمشافي اللي انا شفته. يعني in we have resources. I think we have to go back to that system. يعني احنا وقفنا فتره طويله انه كان في عندنا grants مشان هدول supplies، بس هلا we may have to go back to send يعني more focused supplies. يعني هلا مثل السي تي سكان هذا اللي عم تحكي عليه، اذا حقه جديد 200,000 ممكن ناخده ب 40,000، وبيكون يعني قديم سنتين ثلاثه بس شغال. يعني they will make sure they assure you انه بيشتغل. يعني هيك شغلات ممكن نحن نساعد فيها كثير.
فارس بس كيفك بس مشان موضوع السي تي سكان بس اجاوبك عليه. الحكومه السوريه الحاليه حطوا قانون انه ما بيصير اي جهاز يجي عن طريق المنظمات غير يكون الجهاز جديد مع وارنتي.
جديد ايوه ما
yes
بعرف.
so that's why
نعم
like لو رحنا على الجهاز اللي حقه 200,000. فلا دكتور احسان مأمون الله يجزيه الخير ويعطيه العافيه، يعني he was able to find the best deal و that's why we're working based on that. We got SAMS approval, SAMS board approval، والحمد لله صرنا جامعين شي 130,000 للجهاز. otherwise يعني مثل ما انت عم تحكي I can see their point of view انه هن ما بدهم نصير بسوريا مكب للاجهزه المستعمله. فهذا السبب. هلا هذا الشيء حيكلف اكثر وحيكون عبء علينا اكبر. ايه بس eventually هذا الشيء احسن حيكون.
بس مو بمرحله like emergency stage
بس
اللي نحن ماشيين.
بس that's يعني government يعني قرار من الحكومه. يعني we can't do anything for that. That's a different story.
في سؤال chat بعد إذنكم. It says, is there a point of contact in SAMS where I contact to guide me on what is needed and get me simply just assigned to do this that's based on my area of expertise? Some of us don't know where to start.
ممكن أنا بجاوب دكتور ياسين. هو أهم شيء نبدأ نحن مشان to assign مثلا task إني تكون member. So I encourage you. أنا ما be biased لأني أنا بالmembership committee. أول خطوة إن نكون كلياتنا member. نحن member based organization. نحن unique بهالشغلة عن different US organization إن نحن built by and run by members basically. وقت بيكون نحن على الداتا بيس تبعتنا اللي فرجيتكم اياها، في عندنا 5 GI by the way دكتور يامن. I just checked up يعني في 5 pediatric GI. وقت نحن بيكون we have way more members. We have database. مثلا في عندنا الدكتور ياسين والدكتور ربع اليوم معنا ID. If we need مثلا antibiotic stewardship بدنا help مثلا مشافي دير الزور في resistant او في TB multi drug resistant TB etc. We know to who we can go. دكتور مثلا رفيع، دكتور بربر او other ID. So the first step هي ان نكون نحن member، نكون بهالداتابيس. اذا بدنا حاجه لlecture they will help us, we'll approach them. اذا بدنا medical mission specifically let's say for epilepsy we run the list of who neurologist or epilepsy doctor we have and we contact them. Otherwise the individual work doesn't work. يعني احنا we need to work as a group. شغله انا دكتور شعار موجود بس انا بدي اضيفها. الفند تبع SAMS 75% come from grants و 25% يعني plus minus from private fund. donation, your donation, that private fund. أحد الشغلات الأساسية بالgrant, they ask you how many members do you have in your organization. If you have 500 members, it's different than having 5,000 members. More credibility, more workflow تبع الgrant will be much easier. وانتم أكيد سمعتوا talking about the grant, هلا في pause that all financial foreign aid from US. So now هلا SAMS mainly بتعتمد خلال الأشهر القادمة على البرايفت فند اللي هو our donation و running these project مثل السي تي سكان تبع مشفى الأطفال إلى آخره. بروجكت ثاني نحن بنقدر نقوم فيها. بس أنا برأيي أول خطوة لتنظيم جهودنا هو إن يكون member. That's the best way to be organized or to move forward.
كمان there's another one. أنا مجد حبيبي تحب أنت تعمل القصة، أنا ما بدي أخذ
No,
وظيفتك.
go ahead دكتور طريق. لا الله يسلمك.
It says like, is there any need possibility to do virtual visits for the patients, doctors there? I'm a peds nephrologist, can also be do virtual teaching rounds. Anything about that? Is there a need possibility to do virtual visits?
هلا في نقطة مثل ما قلنا لكم عليها، انه اضرب لكم مثال يعني بالكارديولوجي، انه بعد ما عملنا الرابطة تبعنا صاروا الفيلوز والمقيمين اللي هونيك reach out to us directly. So I spoke to دكتورة ديانا، عطتني inside يعني feedback انه الدكاترة ما بيحبوا هالشيء. و in other programs, not in pediatric, there has been situations where they even threaten the fellows or residents that if they reach to SAMS or any other يعني outside, there will be consequences. So we need to. I've talked to Dr. Samir Ba'li. He's the والدكتور طريف حكى معه كمان. هو رئيس قسم التدريسي للأطفال بمشفى الأطفال. وإن شاء الله we're planning to have another conference call with him. We'll see what we can do without stepping on anybody's toes. يعني to do it in a way that وزارة التعليم العالي مرحبة كتير as far as teaching. You know, they are open arms, you know. بس we have to do it لأنه مشفى الأطفال تحت وزارة الصحة هلا صار.
سؤالي
وين هي
بعده
صارت هي اللي عم تحكي عليها انه they threatened the fellow انه not to reach out?
I'll let you know in private, دكتور.
تعقيبا بس على هاي الشغلة, things will be changing. So down the road probably they will ask for our help. هلا اليوم they share a group of physician hemonc that they are responsible على oncology program in Syria, and actually two people, Dr. Basil Atasi, he's from US, his name in that list, وفي Dr. طارق جزائري هو Dr. Majid brother, he's heme pathologist, right? Hematology, oncology pathologist. On that list that وزارة الصحة عممت أسماء هالأشخاص اللي they would take care of the tumor in Syria, and they could go to any hospital without any permission, basically. So down the road, hopefully things will change, and hopefully they will ask about our help virtually or in person.
So one thing I would like to add also about this point is also trying to establish personal connections with the physicians on the ground. I think that's important. This culture of this is physicians from the US, they have some arrogance, so we need to break that barrier, and we need to personally reach out to them and have a personal contact with them. And I think having in the future, inshallah, the conferences, the missions, it will help greatly and immensely close that gap and partnership with them and get their buy-in and their acceptance to us to help with that process.
Ali has a question.
If you don't mind, I have a question, طريف.
Let me finish the access بعد إذنكم بس لأنه في chats questions. Is there an open access database for members' information?
Open access? No. لأني نحن it's confidential. يعني just because during prior to the liberation of Syria, some they don't want their name to be shared, and we respect that. So ما في open access for the time being for the member.
Another fast question: to change things in these government hospitals, you need to go through administration. Yes, we talked about that. Dr. Haitham Shahrour said, "How do I sign up for a medical mission in pediatric pulmonology?"
خلاص إن شاء الله. I got you, bro. But be a member if you're not a member yet. وإن شاء الله then يعني as we go along يعني I put on the Google sheet. You know, if all of you can please help me out and help the group of putting your specialty, putting in when can you go there, so it will help us inshallah. And what town يعني حتى I put there in what area you like to visit. If one of you wants to go to Homs and he has family there or just want to go there, let us know when and what, and inshallah we can organize it. This is a group effort. نحن we can organize it together inshallah.
Next question.
I will share inshallah كمان link to sign up for medical missions.
Thank you,
My
Majid.
group.
Dr. Faris Bitar, we need to work on being registered with نقابة الأطباء. Can we get special arrangements for SAMS in this regard?
I think we can ask that question, but I think they still have the same protocols. But يعني I can ask the group on the ground to reach out and see what they can do.
It's
نحن
Dr.
ما
Khalid,
عملنا هيك شيء يا أخي خالد.
it's already done. It's already done, and many people they are already joining the نقابة الأطباء. Already done many.
Excellent. Khalid, please go ahead. Khalid Zahdi, please.
Yeah. So I have a question, for the group here. I am as a pediatric intensivist. I would like to help in, doing overview of the current operation of the children's hospital, especially in pediatric ICU. The way I can help, I have experience in building a brand new ICU in the US and being director, and also, in Saudi Arabia at King Faisal Hospital, like the most prestigious hospital, and in Saudi Arabia. So I know how also, things in the Middle East can work. So, and I found from my experience in Saudi Arabia that you really have to do systematic review of the operation of the PICU and the emergency room, and you have to do overhaul. So it's not really enough just to get the best equipment. Like in Saudi Arabia, money wasn't an issue. So we were able to get any equipment that we wanted, but that does not solve the problem. So you have to do systematic review of the whole ICU. You have to have not only business plan about like, what equipment has to be done, what's the cost, but also you have to do overview operation of the whole ICU as far as staffing, including nursing staffing, RTs, the operation, everything else, overview of infection control as mentioned in the previous presentation. So you have to do overhaul of the whole operation. So now the question that I have for you, I'm a pediatric intensivist, like close to retirement age. I'm kind of senior. I'm like Tarif age, and
I'm still young.
How can I help? And 100% volunteering basis, like nothing in return. How can I help in upgrading the whole system, improving quality of care, improving the operation of the system, improving the efficiency of the ICU and the emergency room? So how can I help? I don't want to do it as an individual. In fact, Tarif, suggested do it through SAMS. I've done that in the past. In 2003, we did operation. We did surgery at Children's Hospital, and we did surgery at Al Basir Hospital at that time, with different teams, one from the US and one from Saudi Arabia. So, and I found like, the deficiencies at that time, not really in the OR, the surgeon, but also the efficiency of the ICU, equipment, staff, nursing staff, like, from A to Z, like, basic things are not available. So, as a, consultant kind of, somebody who can give them advice how they can do better. How can we help as a team? And this is one of the questions I have. The other question I have regarding the meeting in July, the SAMS meeting, is that is there a pediatric scientific committee already established? In 2003, we established scientific committee, and we assigned lectures. Do you have that done already? And how can I help too? Thank you for your help, and it was nice meeting everyone today.
هلا خالد حبيبي أهلا.
Nidal, do you want to take the scientific meeting question first and I'll answer the other one?
Yeah, scientific program as general, been assigned a chair. They're going to start working after Orlando conference. As I said, بده يكون في parallel session. وأنا بحكي مع دكتور خالد بدنا إن شاء الله بنعمل pediatric مثل parallel session on Saturday and Sunday ويكون فيه lecture. And I think he will be like one of the people in charge of this parallel session تبع البيدياتريك.
الله يجزيك الخير.
I volunteered you.
الله يجبر بخاطرك. من عيوني. الله يجزيك خير. هلا بالنسبة فكرتك كتير حلوة حكيم، أنا كتير عجبتني، وممكن نحن نعمل مثل مجلس استشاري consultant بكل السبيشالتيز. هلا one of the things I thought about لما عملنا الجروب، شفت شلون قسمناها على sub groups، ويعني ممكن نحن we can in each group assign مثلا somebody who can be a chair and somebody co-chair, and maybe يعني have as a group maybe some meetings on a more regular basis to talk about what can we do. I think at this point يعني because they are overwhelmed and because there is so much on their plate, and they are also apprehended يعني about what's going on everywhere, I think they need our help wallahi, you know. So we need to try to present. I think the best thing is for us to put together something and present it to them and see what they like, they don't like about it. Yani we all know what's going on the ground. We all got a good feeling of what's يعني either from before الثورة أو أثناء بالشمال وبالجنوب. There is a need everywhere. So maybe we can start with one place and do that as a concept. I don't know. This is an idea for the group, and maybe we can implement it in multiple places. The surgeons I've talked to, the pre-op diagnosis is horrible. Yani I've been in places, situations where the doctor walks in and open the kid's heart. He doesn't know the diagnosis, or it's the wrong diagnosis. And then he closed the chest. I can't fix this heart. And or the post-op care, which is horrible, you know, at least I'm talking about cardiac. And the last one, موضوع infectious control. To go back to the ID friend, I don't know if you guys know this, every زرع دم is positive in Syria, across the board. Oh, it's almost always not right. يعني they overtreat everybody. Yani even friends who are doctors who went through surgeries. I have a friend who went through spine surgery, and they put a metal, and he's 6 months out, he's still dealing with infection. So the ID has major role in what needs to happen, inshallah.
الله يجزيك الخير دكتور خالد. طيب ما بعرف إذا نحن I think دكتور طريف already covered all the questions. Do you guys have any other question?
دكتور نجار
Otherwise,
دكتور نجار أخي المجد ترى له سؤاله.
I believe we need to organize our effort and determine goals after we know Syrians' priorities. Yeah, that's for sure. ما حدا بحب ياخذ السؤال.
هو سؤالي بس لو وضحوا يعني انه هلا مو معقول سوريا يتوقعوا من سامز انه تعطيهم مثلا or to provide equipment, provide CT scan. هي ايش قصص دوله، يعني المفروض هي الدوله تتوكل فيها. بس نحن اللي عندنا اياهم بامريكا هي الخبرات، امكانيه التدريب، امكانيه التعليم، امكانيه تعليم الترينرز. يعني عندنا كثير دكاتره بسوريا وعندنا كثير pediatricians، بس they need هلا البيدياتريك مثل ما كلنا بنعرف السيت اب is to prevent the problem from happening. Dealing with subspecialties or dealing with the small missions won't cover the need. I think the need is to train these pediatricians to be better doctors, so they prevent what they can prevent. And then I think it's like a big vision, but eventually we need to know what they need from us specifically, not from what they need in general, because we cannot, as an organization, I think, to provide like medical equipment or build hospitals for them or correct the whole health system, but we can do a lot based on what the collective knowledge that we have.
Right.
Can I answer this question if you don't mind, Tarif? Can I ask this question? Because I have some experience with that. So what has to be done? Yes, SAMS cannot provide the money for that, but what we can do, we can come up with business plan. We do a business plan and see what is the cost, and then you can present it to, donor countries. You can send it to international organizations, and many foundations, in the US and Europe, they'll be more than willing to provide for pediatric services in Syria. There is so much now passion for Syrian children, but we have to really come up with credible business plan that and how much it's going to cost. And there will be plenty of organizations that can donate for that purpose. Cannot come just only from SAMS. That's why I'm saying we have to be, on the ground there, see what is really the immediate need, the emergency need now, so we can serve the population. This is the immediate need, and then we have to have long-term plan. Long-term plan can come with different business plan. So that's how I think it should be done in a very scientific way. Tarif, earlier today and in discussion with him, I say like people who have, experience with healthcare administration, they have to come up with credible business plan, and then we can present it to organizations here in the US and even, even from different, UN programs too.
Thank you, Khalid. Two questions, I think, right? Dr. Lina Al-Khatib said, what is the role of primary care hospital medicine, specifically vaccinations, management of common diagnoses? And after that question, go to Dr. Yahya Abdurrahim to end. What a great way to end with Dr. Yahya Abdurrahim. So Dr. Al-Khatib, anyone else to take that question from the team? The role of primary care, hospital medicine for vaccines, management of common diagnoses. What's the role of primary care?
Is she referring to like how, as a pediatrician in this group, we can help them over there? I'm not sure I understand the question right.
Dr. Lynn, do you want to take
Hey, yeah, sorry. I mean, obviously, mashallah, there was a lot of talk on specialty care and different missions and fellowships, but kind of how can a primary care physician like me, who works in the hospital, kind of contribute to the healthcare system in Syria, and kind of what framework do we have to work based off of, and I kind of threw in some examples. For biggest example in preventative medicine would be vaccinations. Kind of what's the current vaccination rate? What are our barriers to vaccinations? And kind of, is there a framework that we can work with for that?
So Hakime, as far as primary care, it's the main skeleton of this whole building. It's the main thing that we all, drive around. There is a huge need for education, and I think that's the best contribution you or any pediatrician can help with.
Tamam.
There is eagerness. يعني ما بتخيلي قلت لك أنا بجروب on a large scale that are dying just for somebody to come in and teach them. They want to run consults by you, ask you questions. How do you deal with this? What is the standard of care in your country? So one thing we didn't mention or kind of focus on a lot, the SAMS Academic Institute now is setting up webinars, virtual teaching, lectures, and we're going to do it, inshallah, on a big scale. They are hiring more staff, more experience, jumping into bigger platform. It was a smaller, platform. So inshallah soon, we hope I was told in the next couple of months, it'll be available, maybe sooner. So that might be useful. As far as when we go on missions, I've been with doctors, pediatricians who've gone with us on missions. There's a lot of need. There's a huge need for pediatricians. It's not just specialties. You know, فإنشاء you'll be a major contributor in this.
Let's end with Dr. Yahya Abdul Rahim, please. The last question. Yes, sir. What a great way to end.
It's not a question, it's a comment. So up to you.
Please.
Can I stop for a second and tell you about Dr. Yahya? For those who doesn't know, Yahya, how many times you've been to Syria in the north? In the last 10 years?
Around 40 times.
MashaAllah. So this guy is unknown soldier, MashaAllah. You know, MashaAllah, he's been there doing a lot of work on many levels. And I really,
and the university, don't forget, all the universities started because of him. So
yes, wallahi. جامعة إدلب الحرة, حلب الحرة, MashaAllah. مساعدة الأيتام, always focusing on the kids. And when we went in the mission last time, we were there for a week. How long you stayed extra? Another 2 weeks?
5 weeks.
5 weeks.
He stayed
we went in and out. He stayed there and
he stayed 1 month بمخيم أطمة, right, Dr. Yahya?
هذا المخيم اللي لا كل مرة بس كان شهر دائما على الأقل.
شهر
بس هذا
كامل.
مخيم بس كان صعب يعني هذا بال 2012. الله يعني كل مرة بعد ملاحظات سريعة. الله يجزيكم الخير. هيئة سامز يعني مؤسسة بنفتخر فيها كلياتنا حقيقة، وهي أكثر من مؤسسة سورية يعني تأثيرها جدا. لأعطيكم بعض التاريخ الحقيقة، خاصة أخونا الدكتور نجار يعني هلا سأل إنه هذه وظيفة الدولة. صحيح أخي الكريم، لكن أنا رح أحكي لكم قصة مؤلمة. بال 2013 عفوا، جانوري 2013 جانوري 4 كان ما في كهرباء وما كان في تخدير إلا conscious sedation. 5 قيصريات، 4 حضرن أخوي pediatrician، وحدة حضرت أنا. برد درجة الحرارة -4، لأنه في أخ اقترح إنه نطلب من الدول. حضرت هاي القيصرية، الأمرأة عم تسوي قيصرية، برد شديد. أخذت الحرام البلانكت، I put it under my armpit. I tried my best. I received the baby. 5 babies very healthy. 5 of them died frozen, including mine. فما حدا يقول لي الله يجزيكم الخير. لا ما بفهمان. هي دولة. الآن عم نقول نحن سيتي سكان، ما في سيتي سكان. بما تسأل الدول وتجيب، الله أعلم كم واحد يموت في دمشق. فنحن هذه وظيفتنا الأساسية الآن. لأنه لما كنا في البداية في لحظة من اللحظات، أول مرة بنزل كنا 7 أطباء أطفال فقط في مدينة حلب الشرقية. كنا الحقيقة نشوف 200-300 مريض primary care. بالنسبة للأخت اللي عم تسأل primary care, if you are over there, you will be great to do, I mean basically round and see the rounding with the pediatrician resident. الحقيقة كثير ممتاز. outpatient كثير شغلات ممتازة. طبعا العلاقة لازم تكون أيضا واضحة. ذكر أخونا الدكتور خالد إنه بعض الأرجنسي الحقيقة هي بتصير، لكن في البداية مرينا فيها نحن بال 2012 13 14، لكن بعدين صارت العلاقة ممتازة وجيدة جدا حسب الأسلوب. كلما زاد الإنسان تواضعا زاده الله رفعة. أنت بتروح أنا موجود هون، إيش what can I do for you؟ يعني حتى لما بتكون حتى الآن يعني تسوي كونسلتيشن بشكل مستمر خلال 13 سنة الماضية. علاقتي مع الأطباء ممتازة جدا. بقول له المعلم الأساسي الطبيب اللي تشتغل معه، لكن أنا بقول لك بساعدك وجهة نظري ممكن تشرحها مع الأشخاص الآخرين. فالعلاقة ممكن تكون جيدة وطيبة جدا. فدورنا مطلوب منا أشياء ضخمة جدا. طبعا أنا الحقيقة عم بشتغل في سام حتى الآن بروح معهم، لكن I shifted بعد ما اجت قيادة في إخواننا في سامز، لأنه سامز دخلت and make a big difference حقيقة بعد 2018 لما دخلوا لجوا. دخلوا أول مرة بال 2018 إلى الداخل. كانت العمل بال 2017 وما قبله بغازي عنتاب، محاضرات دورات، ثم بيرجعوا الأطباء لجوا. لكن هيوج ديفرنس حقيقة. في شغلات ما بتعرفوها. هن بيساعدوا إخواننا في اليمن، ساعدوا إخواننا في ليبيا، ساعدوا إخواننا في غزة في العمل الطبي. فهذا عمل حقيقة جيد جدا. I shifted للإديوكيشن لانه يعني مثل ما قال اخونا دكتور خالد دكتور طريف، يعني عم نبني مدارس، نبني الجامعه، اشتغلنا في 15,000 طالب، ما بدي احكي عن التعليم، لكن كلياته ايضا متجه نحو الاطفال. فكل واحد بيناتنا ممكن يقوم بثغره، يعني 5,000 $3,000 $1,000 $100 جيد، واللي ما بيستطيع كمان خير، بيساوي ميشن، بيروح بيزور أهله وبيدرب الناس هناك. حقيقة في عمل ضخم جدا جدا موجود لكل إنسان، وما في واحد ما له شغل. والعمل مثل ما قال أهم شيء هو الأورجانيزيشن، إنه نشتغل من خلال سامز. أنا أعتقد you will be able, as long as your name is on the list, they will contact you and you'll be able to go on monthly basis, weekly basis, whatever you want to do, you will do great job. الله يجزيكم الخير، شكرا كثير.
يعطيك العافية.
شكرا
دكتور يحيى حكاها مهمة كثير. بتجوا مع السامز بدكم تفوتوا مثلا على مشافي، بدكم موافقات أمنية، بدكم موافقات هذا كله سامز بتأملكم، يعني ما هيك دكتور نضال؟ يعني هي نقطة.
of course.
بس إذا ممكن أضيف شغلة صغيرة يعني مشان موضوع البرايمري هيلث كير والهوسبيتالز. وقت كنت في دمشق يعني الشهر الماضي، وقت اجتمعنا أول اجتماع صار مع ال WHO واليونيسف، what they told us, the healthcare system in Syria is really collapsed. Public health is a major issue. Not just you want to build this center of excellence, that's great. But the basic, you need to look at the basic, and vaccination is a big issue, teaching and screening. So there is so much need in this. So the primary healthcare take care of 80% of the problem, 80% of the population. So it is so much needed. It's definitely, so this is an area, as stated, it's very much needed. Lastly, I mean, Dr. Yahya, Jazakallah khair, he mentioned as well regarding CAT scan and so on. I mean, just to tell you, this is just yesterday, we received a request from the university hospital in Aleppo. They need fuel. They don't have money. This is from the Ministry of Health asking us, can we supply them for 1 week for fuel to keep the generator running? We received as well a request from the Children's Hospital in Damascus. We need oxygen. So can SAM help us in these? So SAM did. So there is a need for medication, there's a need for consumable, there's a need for equipment, and the list goes on and on and on. The ministry need our help. So everyone need our help. So whether it's in expertise, in education, in teaching, in training, or even just providing the basic supply they need there. So this is whatever we're able to do, it's really will make a huge difference. So I ask everyone to continue your enthusiasm, continue your motivation, and the children in Syria in need of you all. So Jazakumullah khair, and again, so thank you.
على ذكر السي تي بس بدي احكي بس نص دقيقة. تخيلوا انتم بيجي طفل على مشفى الاطفال بدمشق تراما كار اكسيدنت وبكون change mental status. How are they going to diagnose what's going on without CT scan? هذا الحكي برجعني وقت كنا نعمل تلي ICU بحلب، وقت كانت مقسومة نصين، كان في جزء برات النظام، مشفى الصاخور كان لسامز، وتعطل السي تي سكان وما كان في قدرة اني يجيبوا سي تي سكان او يصلحوه لمدة 6 أشهر. وقت بيجي كان الاطفال على العناية المشددة، كان في جراحة عصبية ياخذون على الاو ار بيس اون ذا اكزام والاكس راي. حدا بتصور اني انت في واحد بده يفتح جمجمه بيس اون اكزام اند اكس راي؟ بس هذا الشيء موجود. يعني هذا يكون مثلا ابني او بنتي بدهم عمل جراحي، فتح دماغ جمجمه بيس اون اكزام اكس راي، يعني away from the basic standard. بس هذا الموجود. وهلا نفس الشيء مشفى الاطفال، maybe هذا الموجود وما عم بيقدروا يعملوا اكثر من هيك. يعني ما بتقدر انت ولد حالته خطيره ومع نسف دماغ تاخده على غير مستشفى، بدك تعمل emergent craniectomy for example.
اخي باضافه الى كلامك الدكتور عبد الفتاح ذكر، لا سي تي سكان، لا ام ار اي، ولا اكس راي بتشتغل. مستشفى حلب صار له بالضبط 7 ايام عم بينادي بالفيول. انا جاني الخبر ب7 ايام ابدا، والقمامه معبيه الدنيا. فانت ما بتقدر تنتظر لانه ما في فيول، ما في وقود. بدك يعني تشغل كل الاجهزه، يعني حتى الاوبريتنج روم كانت ورك. بدك فيول. والدوله اللي عم بيقول الدوله، يا اخي الدوله ما عندها لا راتب ولا مستلزمات ولا ولذلك نحن وظيفتنا ندعم هذا البلد حتى نستطيع نصل الى بر الامان. ولو شهرين بس. شكرا.
الله يجزيكم خير ويعطيكم العافية وشكرا كثير. طيب إن شاء الله إلى لقاء قادم بإذن الله. نتحدث عن جروب صح؟
إن شاء الله أكيد.
إن شاء الله.
الله يجزيكم خير. أنا بس إلي طلب وحيد من الجروب. First way to prove إنه you really want to be active, join membership. We're going to see how you are going to be involved, inshallah. First act is join membership.
3 years membership.
3 years,
I got you
that
for
will
3
be
years.
over my head, يعني على راسي, okay? But join membership, show commitment. That's how we know, inshallah, you're really going to be a good active. A lot of talk about, oh, we have 120 members in this group. But how many of those really going to make a difference? First act, join membership. Second act, if you can donate, that would be awesome. Third act, join the work. We will be more than happy to share the love of working with you.
في ناحية أنا لاحظت كنت عم شرب اللينك تبع الدونيشن اللي بعته أمجد راس، بس في 4% على فكرة كريدت كارد تشارج. هلا إذا السؤال اللي أنا كنت بدي إذا بدك تبعت تشيك مشان to avoid the
yeah you can write a check.
بس مو هيك بعرف أنا بس if I want to dedicate my donation to children hospital مثلا, I can earmark my check.
Yes, you can. You can just write in the memo. This is going to be for pediatric, small support for pediatric services. And if you want it to be for a CAT scan, you can say CAT scan as well. You can be very specific. It will be honored.
And Dr. Abdel Fattah, you made a link also for pediatric medicine.
Yes, there is a link for pediatric as well online. I just share as well the website on the group. So you can go and find there's a pediatric link. You could go ahead there and donate. And then the address on the website, if you want to send a check as well to the address, you could do that. And then write in the memo, this is for pediatric program.
شكرا كثير لكم. الله يجزيكم خير.
الله يعطيكم العافية وصحة كثير.
تصبحوا على خير.
موفقين يا رب. الله يعطيكم العافية.
شكرا دكتور مجد، غلبناك معنا اليوم.
الله يسلمك. لا ولا
ادولت شو اشرح.
واجبه معلش.
السلام عليكم.
نورينا، اهلا وسهلا فيكم.
يا اهلا وسهلا.